The question is we know we can do this to a large extent now. Should we do it? There are two camps. One saying, this is the patient's information. This shouldn't be the nanny state. If the patients want information hidden, they ought to be able to hide information. And if they know that there are risks involved and they're willing to take those risks, who am I to tell them they can't? On the other hand, there's a camp that says, healthcare is an information business. And if you think I'm a general internist, if you think what a general internist does in primary care, 99% of the time what they're doing is they're managing information. They're either collecting it from the patient or from the record, they're doing tests, they're doing a physical examination, they're recording information, they are transmitting information by saying, I would like this patient to get a mammogram. You have to let somebody else know that you want that happen. What we call orders. So most of what we do is manage information. And the ability for me to provide high quality, safe care depends on my being able to get my hands on the right information for the right patient at the right time. And for people like me who work in primary care, I'm responsible for all of the patient's care. So how then can I do that if I can't see the information? Can I be expected to deliver safe, high quality care if the patient's saying you can't see my records? This is the contention, is that patients should have control, the provider should have the information. So how do you balance those things? It's very difficult. What the privacy advocates would say is that we know from prior research that if the patients don't feel that their information, that they have control over their information, they don't tell you sensitive things. They hide information from you because they're not sure who's going to see it. And they have a point. I mean, should the clerk in the office be able to see your mental health information? Should your podiatrist see your mental health information? Should your physical therapist see your mental health information? I mean, who really needs to see that information? So I mean, they have a point there. On the other hand, the podiatrist may be prescribing a pain medication for which you've abused in the past. So can you hide your abuse information from somebody who's going to write you a prescription? I mean, what should that person expect when he looks in your record? Should he be able to know that what he's doing is safe? So, and how can you predict? How can you know? So this is the conversation that's happening right now nationally. And ours is the only study to ever look at it. So it's beginning to inform what's possible and what people think about it. We have the technology to do this. And as we evolve natural language processing capabilities, which a number of people are doing, including us at the Regenstrief Institute, we can more and more control what's visible within a patient's record, even in free text notes. So then let's have this conversation and arrive at a medium where there's some compromise between what the healthcare providers need and want to see and between what the patients need and want to control. But there's no right or wrong answer to this. It depends on a trade-off between privacy and healthcare safety and quality.